However, we do think it's important to raise the specter that when you are making decisions about fundamentally changing the constitutions during periods of heightened rhetoric as we're in now, that sometimes that leads to unintended consequences. And I think one of the examples that I laid out in front of you shows that that could be a devastating unintended consequence of this resolution.
Mr. Chairman.
You're in.
If everything you say is right, then why do you worry so much about giving the people of Florida a chance to express their opinion on the issue?
Mr. Chair. Absolutely, people will have the final say on this issue should it be placed before the ballot. However, and I know that your constituents are amongst those that have sent these fine individuals to represent us here in Tallahassee, and they anticipate that if something is placed on the ballot by the Florida legislature, that it has been carefully weighed, and all of the policy implications that could be involved have been carefully weighed, and we're simply asking you to do that today.
Thank you, Mr. Chairman.
Thank you.
Thank you.
All right. Representative Anthony?
Sir, I have a question.
I'm sorry, one more question.
I apologize, Mr. Chair.
It's all right. Sir, you've given a very entertaining presentation in this political theater here today. But my question is this: is Washington or is the AFL-CIO going to help us pay for this serious drama in Florida's political theater?
You're in.
Mr. Chair. I believe you mentioned earlier, sir, that you were frustrated with constant referrals to the Congressional Budget Office. However, as the recognized body to tabulate these issues and calculate those numbers, we are very confident that the cost of doing nothing is far greater for the taxpayers than the cost of taking the actions that were suggested last night. But again, I'm not here to defend what happened last night in Congress. I'm here to try to bring forth an issue of potential unintended consequences and the explosion of Medicaid, which over time will cost Florida taxpayers much more than anything that Washington does.
Follow up, Mr. Chair.
Not buddy like
There's no doubt that Medicaid is the single greatest cost to Florida. Just for clarification, I didn't say I was frustrated at anything. I said I was tired of hearing the CBO. And are you telling us that your organization then are the ones that have been appointed to calculate all these numbers?
You're recognized.
No, sir. The figures that I shared with you earlier were not calculated by us. They were calculated by the Kaiser Family Foundation, one of the nation's leading nonpartisan experts on the healthcare issue. The rest were calculated by the Revenue Estimating Conference over the last 3 years here in Florida.
Thank you, Mr. Chair.
Representative Robertson, you for a question.
Thank you, Mr. Chair. Very quick question. In fact, hasn't Washington already been helping us pay for health care here in the state of Florida?
You're recognized.
Washington doesn't pay
Well,
for
I mean, I
anything.
think it's important for everyone to remember that the Medicaid system itself is based on a formula that represents a state and federal match. So yes, a significant portion of our Medicaid system is currently funded by taxpayer dollars. I don't like to say funded by the federal government, though. It's funded by Florida taxpayers because these are tax dollars that we send up. However, because of our budget problems, every time we make a cut to Medicaid, we are giving away those dollars that are given to other states. So the Medicaid problem in Florida is actually a double threat because not only do we find ourselves in a position of having to cut state dollars into the Medicaid system, that also dictates that we have to give away state taxpayers money that will go to other states to shore up their Medicaid systems, and we don't draw that back to the people of Florida.
You're recognized.
Thank you, Mr. Chair. In fact, but for
Do we want to dance with federal
Washington money,
funds? or
we
not?
would not have been able to bridge the gap in our healthcare budget last year and this year. Isn't that a fact?
I can't speak to, thank you, sorry, Mr. Chair. I can't speak to whether or not that is a fact. That is reflective of the budget documents that I have seen come across my desk that have informed portions of my analysis in terms of whether it's a fact or not. I think I think so, but I can't attest to that for certain.
Representative Ray Winkle-Vasilenda, you for a question? Did you have a question? Oh, I'm sorry, Representative Friesen for a question.
Thank you, Mr. Chair. In the time that you've spent observing the Florida legislature, let's just kind of identify Florida because that's what we're talking about now. How many constitutional amendments have you seen pass this body and eventually be added to the Constitution?
You're recognized.
Thank you, Mr. Chairman. Unfortunately, I don't have those numbers in front of me. As someone who has worked on several constitutional amendments that have been before this body, I do have that information, but I don't have it in front of me. I apologize.
You're right.
Would you say intuitively or just from your knowledge, there have been more or less constitutional amendments than bills passed?
You're recognized.
Certainly, yes, less.
So it would state to an extent that either the process itself or the manner in which a bill gets passed, which is in essentially what happened in Congress, a bill was passed and not a constitutional amendment, and what Representative Plaken is doing here, which is a constitutional amendment, that inherently the process, the scrutiny, the due diligence, and the process in order to be able to pass this is much higher, much more scrutinized, and certainly much more vetted than a regular bill would be?
You're recognized.
Well, if I'm being asked to compare to the legislation that passed last night,
No.
well, the Florida legislature meets for 60 days, Congress meets for a much longer time, and some bills are in discussion for years, so I hate to cast a...
Let me just interrupt you for a second. The clarification of the question was, is it easier to pass in Florida a constitutional amendment? Does that go through more scrutiny than the scrutiny of a bill going through the legislature?
Yes, sir, absolutely, and that's the process that we are counting on and why we are here raising this issue, to give you all of the facts and perhaps raise an unintended consequence that perhaps had not been raised to this point.
All right. Thank you. All right. Thank you. Ray Winkle-Vasilenda, as representative, you have a question. Sorry.
Thank you, Chair. I know you're not a lawyer, but do you think if this constitutional amendment did pass, that it would survive the supremacy clause of the United States Constitution?
You're recognized.
Mr. Chair, as you spoke, I am not an attorney. I have seen some attorneys, constitutional attorneys, debate this issue. You know, one thing as a non-attorney who's often surrounded by attorneys that I often find humorous
Abuse.
is that we all like to throw around words like it's unconstitutional or it's constitutional, and usually that just is based on what we want, not necessarily on constitutional law, which tends to be a much trickier animal. So I would hesitate to answer that question one way or the other.
Thank you.